Welcome everyone to the May OAC TV broadcast. Is this something, it feels like it normally does, Christy, but something feels different.
I think it's because we're streaming from a whole new platform for our official May broadcast. Welcome to OAC's YouTube channel. This is exciting.
This is very exciting.
It feels the same in here, but I'm sure different for everybody else.
Well, and
right?
we listened. People said they wanted to see us on YouTube.
That's right.
So we made this change. So thank you for everyone who's tuning into us via the OAC TV's YouTube channel.
We're even all in on YouTube because we have our mug here. Thanks to our tech guru, Chris. Thanks, Chris, for this lovely YouTube mug. We're really all in on YouTube, but happy to have everybody back on a line, but YouTube's a great new platform for us to stream live, so lots to stay tuned for with this. Our YouTube channel's gone through another big change in the last, couple of weeks.
Yeah.
So it's going to be a place where we're going to stream so much more content, so lots more to come there.
And definitely use the chat. You're going to want to use the chat throughout
YouTube,
YouTube, as that is how we're going to be choosing our giveaway winners a little bit later on. So make sure you guys always have great conversation. We always used to see it on Facebook, so make sure you're carrying that conversation over to the YouTube chat as well.
Yes, and so today, before we jump into seeing who's joining us and all the great news about OAC and our topic, but today's discussion topic is all about mental health. As you know, it is Mental Health Awareness Month, and I think staying tuned to social channels, you've probably seen that across so many different places. But today it's going to be a great conversation with one and only Merrill Littleberry.
Vitamin M is here.
Vitamin M is here. For those who have attended conventions, she's taken our main stage a number of times. She's a crowd favorite. So excited to have her. Actually, we haven't seen her in so long.
It's been a long time. Yeah. And Merrill is one of those speakers at convention where sometimes you guys have the special sessions and people have the opportunity to add that on. And it's always so amazing that you have X amount of spots, and those spots are gone within minutes because everybody knows that Merrill is going to be the speaker for it. So we're very, very excited to talk to her a little bit.
We're hyping that up, but no, you want to stick around for that great conversation. We're going to unpack mental health from a different perspective, and from a perspective we know that means so much to all of you viewing at home. So excited about that, but before we dive in, let's say hello to our audience on our new platform
here.
Who's
watching us on YouTube today? So it looks like we have Shelly from Temecula. Shelly,
we know Shelly. Shelly, it's so good to have you. And then we also have, looks like Laura joining us from Niles, Michigan, as well as we have Mary from Cape Cod, Massachusetts. Welcome to our YouTube channel broadcast today.
And we want to say hello to Jay from Alexandria, and then Jen from Idaho as well. So hello, Jay. Hello, Jen. Welcome to the broadcast.
Yeah, we have a couple already comments that we're seeing here too around excited to see Merrill. I think, again, we knew folks would be happy to see her again. And that an individual said that mental health is a big focus for him. So perfect timing on this. So excited to dive into that. And that chat is so important. Why is it so important?
Well, because that's how you could win these amazing giveaways that we have today. And so we're giving away two very special things on today's broadcast. The first one is
the official OAC tumbler. We brought it back for this giveaway. It's a highly coveted item. Make sure you're commenting, and we'll do the drawing at the end. Plus, we're going to give away
a full convention registration to YWM 2021. So very, very excited about that as well.
Yeah, so lots more in store, and we're going to dive into this important topic of mental health. But before we do that, we want to update and hear about all the stuff that's been happening.
There's a lot. I mean, this has been a busy month.
Sure,
very, very busy. We know convention is coming up. Registration just opened up on May 5th. But there's so much going on right now.
Yeah, we certainly kept pretty busy. So one thing I wanted to mention, because it's a program my team has worked on, is we did debut a new program actually this past Saturday called OAC Health Talks. And so this was a fantastic new initiative that we're doing to really bring relative topics to our community in an easy to understand and a really shorter format than ever before. And so we streamed that live on our YouTube channel this past Saturday. It was a recording, and the topic was all around COVID-19 and getting back out there, because that has been a definite, concern of folks, I think, in this
we've gotten a lot of questions about that. Yeah. And I tuned in for that. I watched it on the OAC's YouTube channel. And it was phenomenal. Robin Pashby, the clinical psychologist, was fantastic. I think what she shared and what Joe talked about in there as well, I mean, it was a very, very good good health talk for us to be able to share with the public.
So while we're hyping that up, if you missed it, no big deal. It is on our YouTube channel, so you can easily scroll. And actually, there's an image there right there that shows you on our YouTube channel how to find it. And it's a great resource. Watch it on your own time. It's available for free, and we certainly hope that you can take a few moments to dig into that. It was a really great talk, and those talks are going to happen more frequently.
Right.
We're committed to doing those more on a quarterly basis, so stay tuned for lots more to be had around that. So definitely check it out.
So in addition to that, we have the official spring issue of Weight Matters magazine, which many of you may have received it in your mailboxes. I know I got mine. I know, Christy, you said you got yours as well. So this is the OAC's official publication, and the spring issue talked about a great amount of topics in there: making home fitness affordable, health benefits for yoga for children, and of course the magazine is available online, and it's again going out to anyone that has premium access membership within OAC as well.
Yes.
You should get a hard copy of that in your mailbox.
I already got mine actually in my mailbox, which is always exciting, and that's what's great about premium access. It's only $25. You can get that print subscription to the magazine, which these days it's hard to come by, right? So it's exciting to get that in the mailbox every single quarter. So a good reason to add that on if you haven't, and lots of other great perks for that as well.
Yeah,
we also have more news on the resource front.
Yeah,
too.
so I mean, the one thing that OAC always strives is to make sure that all of our resources are updated and current, and we actually just revamped. Many of you may have seen our Understanding Your Weight Loss Options brochure. We revamped that entire brochure and renamed it. So it is now the Understanding Your Obesity Treatment Options brochure. A lot of new information included in here, new FDA-approved treatments included, more information on health and wellness as well. This is one of the OAC's most popular pieces. It's one of our oldest pieces as well. But you know, the beautiful thing is that we're always going back and improving on our resources, which are so highly requested and so highly sought after. And so,
well, and I'll give you guys a shout out for your team, because you guys do a remarkable job of updating that piece. I feel like it's every month there's an update, which is good news, because then we're getting more updates on the treatment landscape, more innovations happening. But it's fantastic because it is a current piece, and so you're not going to pick it up and think, oh, this information is outdated, this isn't even available. It certainly is all very relevant and up to date. So
yeah, a lot of credit goes out to Maddie on the OAC team for
shout
that.
out to
Maddie
Maddie.
worked very hard on updating this brochure, so kudos to Maddie. And we actually have people talking in the chat right now. So Laura says, I love the home fitness article in the new magazine. So Laura, we're very happy that you like that. And then, I don't know, there's got to be at least 5 or 6 messages here about everyone that loves Merrill. She's a great speaker. She's awesome. She's life-changing.
We'll get to her.
We're going to get to her.
Yes.
We just bring her on now. We don't have to talk about OAC.
No, we have some more important stuff.
More important
We're going to get a good chance to talk with her. One of the things we also have to update on is a couple weeks ago, and you heard us talk about this on our broadcast last month, but we did officially open convention registration for our annual meeting this summer. So July 17th to the 25th, we're going to gather once again on our virtual platform. And our convention is truly a fantastic educational program. I mean, you can jump on the website to view all the fantastic topics. Again, shameless plug, Merrill is going to be speaking this year on our virtual platform. But we did officially launch registration. They're pouring in every day. It's so exciting to see that.
You know,
because
Christy,
online allows us to do that.
One thing I noticed about this year's convention too, when I was looking at the program agenda, there's a lot of new stuff.
Yeah.
I mean, and it seems like it's grown as well, which is just phenomenal, because we know so many people want this information and all the cool things that come with it. It's connect with the experts, the different events that are associated with it.
Yeah, this year's convention is going to be pretty unique because, you know, we're able to really bring it back to almost what an in-person meeting is. It's, you know, not always exactly the same, but we're trying our very hardest to bring that essence back that the virtual platform can offer. So we're going to do a social event on Friday night during that week. I heard you're going to be doing some fun stuff during that.
I don't know.
Maybe it's a surprise. We haven't told him yet. But.
I haven't been assigned my topic yet, so I'm nervous and excited at the same time.
Yes, but so it's a good call to action. If you have not yet registered, registration remains open. We have a free option once again, so those who want to watch in real time to check it out, you're welcome to do that. But we also have a full convention registration that starts at $50, and you get access to everything on your own time. It's a great value. Plus, we're also offering an amazing number of CE credits for those health professionals who want to also
So
attend.
I think I saw 16.
16 CEs.
I think
Great
that's
value.
one of the highest numbers I've ever seen
Yes.
for us for convention.
Yes, it is actually. So check it out on the convention website. We also got some good remarks here in the chat about someone who's already registered for the convention. The very minute they got that email, we do send a lot of emails, but I'm happy that those are working. So that's great to see. So lots of excitement on the horizon for that. So without further ado, I think, are we ready to bring on our esteemed guest today?
Listen, regardless if we're ready or not, I think the people
They are
watching
ready.
are ready. They are just waiting for her to come on, which is a great segue for today's discussion, which is really talking about connecting your mental health. And this is meant to be an open discussion with Merrill. And I think, again, we've talked so much. You've heard that word mental health so much throughout the past year, and we've really started to dissect that a little bit with Merrill. And so we're super excited to have her on and be part of this discussion. So without further ado, what everybody has been waiting for the past 12 minutes
No
now.
pressure.
Merrill, are you there? Everyone is waiting. How are you?
I am here chilling. How are you guys?
Her
It's so
energy
neat
levels.
to just reconnect to everybody. It's weird because I'm just seeing you guys and I don't see all the love going on, but I appreciate you guys translating it here. It's been a tough year for a lot of people, so you never can have enough of what's going on over there.
No. We're so thrilled that you're here, and yeah, rest assured, I think that this is a very relative topic right now, especially. And so I think to start off, I know we wanted this to be really an open discussion. We know mental health is such an important topic for so many people, but specifically there's some unique needs for our community, and I know this is something you know so well in the work that you do. But what I kind of am always thinking about is the fact that mental health is a term that's thrown around so much these days, right? So let's maybe start there a little bit. And what's your perspective on that, about how we connect mental health to everything in life, and especially with COVID? So what does that all look like?
I think you're right. Not only do we throw it around, I think people that really suffer with, true diagnoses kind of get upset because, someone's like, oh, I'm depressed. I feel depressed like you. And, they just had a bad hair day and maybe somebody else hasn't washed their clothes in a month. I mean, it's a big, big difference. One of the things to look at, of course, I always want to do a little bit of research, make sure that I know that I'm up to date on things. And what was interesting is you're going to find a trend where where it will say mental health condition. So we're trying to make sure that we decipher the two. Do we really understand the difference between, hey, I have a mental health issue, or do I have a mental health condition or a mental illness? I think that's really important because we can down talk or not know a person has one or the other and make things worse. And both times, if somebody's gone through a really rough time with mental illness and maybe their child says, oh, mom, I'm depressed, they might freak out and want to hurry up and go take them to an inpatient because of what they experienced. And then vice versa, oh, I've been depressed, you'll get over it, pull yourself up by the bootstraps, but you never notice that that person doesn't even have boots. So what are we pulling up? So I really think, listening, first of all, and understanding how we're using the words back and forth. So I think it's going to be as important. I'm going to give you guys some kudos because I was looking at the CDC, and on the actual CDC, this world organization, I'm looking at the obesity numbers and kind of seeing if they have anything. And it shows, almost like we're talking about mental illness, we don't say, oh, this person is obese. This person has obesity, and it has your link. You guys know that,
Yes.
right? Like, I might be behind, but that was so exciting, such a proud moment. I've just seen it. I'm like, OAC, wait,
It's
OAC,
a big deal.
provided, this link, and it's on there, and it's talking about, hey, the same way I'm, I'm not hair, or I'm not schizophrenic. This person is suffering with the condition of obesity, suffering with the condition of schizophrenia. So I do think both of those need to follow in there. Like, if we think about that thought, it will help with how we understand that.
Yeah.
I'm struggling with depression. This last year, I think COVID has taught people a lot of lessons. And, when it comes to mental health, where we're talking about day-to-day things, right? So if we're really talking about mental health versus mental illness, mental health, we're talking about, hey, I always refer to my 5 accounts, your spiritual, intellectual, nutritional, physical, and emotional. Those, when we look at those accounts, are they balanced? Can I get up and go to work? Can I function? Can I have friends? Am I holding a job and still doing okay? How resilient are we? You know, we're going to have issues. Do we bounce back from those? Now, mental illness is when we're not doing that. Maybe when we're depressed, we're not washing the clothes, but at some point we kind of get up and do it. Mental illness, at some point, and I've had patients, they're like, at this point, I'm just trying to smell the clothes to see which one is the cleanest.
Yeah, no, and I think that distinction is really important to make in a lot of ways, because that term mental health is so rampant, especially it is Mental Health Awareness Month, but I think, of course, you know, what does that really mean? And I think you really kind of separated that. But I think one thing I remember when we were having a conversation recently that really kind of made me go, oh, that's interesting to think about, is that with the pandemic and with COVID-19, that if we knew back a year ago that we knew it was going to be 2 years that we were going to have to make all these adjustments in life, how much different would we all maybe be in terms of mental headspace around it? But I think some of the things you pointed, which were really so very true, is that not knowing day to day what to expect, or that, to me, I didn't even think about that when you mentioned that. So I thought that was really fascinating.
Yeah, I mean, you see it. I mean, hope, you know, hope is a wonderful thing, depending on what you're hoping for, you know.
Right.
I mean, and that's hard because, you know, you don't want to tell somebody to not have this virtue, but if it's taken to an extreme, it can become a vice where, you know, I'm hoping he won't hit me anymore. I'm hoping, you know, like there's certain things. And I think for this particular pandemic, hope might have kind of had a double-edged sword.
Yeah.
We have hope that we're going to come through and we're going to be resilient and make it through, but instead of planning and being purposeful, we just hope things were going to go back. We hope they were going to figure it out. We hope they everything. You know, we blame people for this and then we blame them for not doing it. And so it's just been chaos. Now let's add on political things that gone on, financial things because people have lost their jobs, and you know, just what the media is saying. You couldn't turn on a channel without like getting inundated with just negative stuff. So I think for me, you know, when it comes to mental health, mental illness, obesity, you know, you hear to some extent a joke where people say, you know, I got that COVID-19, and I'm like, oh, you got COVID? Are you okay? They're like, no, I got the 19 pounds that came with it over the year, you know? So like, they're, you know, they talk about that. Well, why is that? And so I do believe it did have not only an impact with people that are already fighting with obesity, but I think a whole lot of new people are now experiencing a place that they haven't been. So I think for what you kind of said is these are different circumstances of what happened.
Yeah.
And for me, I think if we could learn what COVID taught us, we could really like adjust our mental health. So I think COVID gave us the tools that if we apply in the area of mental health, and again, this is probably going to be one of those M moments, but you know, I think about when we knew that COVID was dangerous, right? We didn't want it in us, right? We didn't want it in us. So I always tell people, like, anything you allow to become part of you, and what you listen to, what you watch, what you smell, what you allow to become part of you, is it going to help you, hinder you, heal you, or hurt you? And so what did we do when we knew COVID was dangerous and we didn't want it? We put on masks, we washed our hands, because we didn't want that germ. So we created a boundary from the germ, right? This germ we did not want to catch. You know, we started Googling home remedies. How can we do things that are homeopathic? And I'm not saying go search the internet, because you go crazy doing that, becoming a Google MD. But we looked for ways to try to fight and be as strong as we could be. You know, hey, maybe I'll try this. Maybe I'll take more D. Whatever it was, we still looked for a way to be healthier, to fight back just in case we got it. We stayed away from high-risk people, right? And the government got involved. To me, if we could learn what COVID showed us that we'll do when we become united for something bigger than us, because all of a sudden we became more familiar with each other, and we realized how much more we are alike than different, and we came together. Man, if we would do that more about obesity, if we would do that about mental health, look at what we did. We did leaps and bounds.
That's
different.
So
we did that with those two areas.
And Merrill, you touched on some important points, and the chat is just on fire right
I'm
now.
watching that too.
Diane
In a
says
good way.
uncertainty is challenging for her. This past year has provoked her anxiety. And Shelley's mentioning that she uses a meditation app to help her. And I think you kind of, the one thing that, you know, you mentioned this a little bit about using online resources and finding what works for you. And we talked a little bit earlier this week about the importance to not self-diagnose as well. So I think, again, mental health and mental illness, those terms, unfortunately, in some ways have almost become interchangeable, I think, in mass media. And we know the importance of one and the other, and they're both equally and very important. But why, if someone thinks that they're battling with mental health or mental illness right now, why is it important that they talk to a healthcare professional versus just going on Google and figuring out and saying, yep, that's me, that's what I'm experiencing right now? Why is it important that they talk to an expert about this, somebody such as yourself?
First of all, is because we'll seek out what we believe. We'll seek out information that would justify what our belief is already. Maybe I started pulling my hair. I must have trichomania. I must have that. And so we'll look for what justifies our belief. We don't have tendency to go look for other things. Oh, look, this thing said this. I must have this. And we'll look for maybe what somebody else told us. So we'll keep searching. 10 different sites might tell you you don't have this, and you'll find that one site that kind of leans to it, and you'll stick to that site. So to me, that's the first thing. We've become a internet, social media, generation now, and there's a lot of non-professionals out there giving really professional advice without, any kind of research or backing, and just based on, personal experiences. Oh, I took this and I did this and I did this, and it really may have worked for them. That doesn't mean it's going to work for you. And so I think it's really important to talk to somebody who can listen to the whole picture, not just one little part. You see people go through major, just even this year, the rites of passage, prom, funerals, weddings, babies, being sick, like just going through that and going through normal grief. I have many parents who called in trying to get their child seen because they thought that their child was clinically depressed because they couldn't go to prom. I'm like, they're grieving. Like, that's grief. That's a loss. How many years have you been looking forward to prom or to graduation? They have to mourn that loss. And so that is a mental kind of health. Like, their mental health right now isn't good because we're grieving. Now, in 6 months, if your kid's still sitting in there, doing the same thing now, or 6 weeks, we're going to talk about something different. We have adjustment difficulties. So, yes, it's very important, because if you're misdiagnosed, you could cause way more problems than you ever had to begin with.
Yeah. No, and I think it is true, and I think that's why this conversation is so important, to really know how to kind of separate those two things. And I know, like, specifically for our community, and you've touched on this too, Merrill, and what we've been talking about is that, especially during this pandemic, and I feel like that's all we're talking, you can't help but talk about, just because the impact it's had on life, right? But, we think about the connection of, mental health and weight specifically. And, you talked about this COVID-19, not the virus, but, the 19 pounds or which, and that's been, I've seen tossed around so many places, not even just within our community. This is, like you said, outside, but like this idea about how self-image and our self-esteem has been so connected to weight. And then, of course, you couple this with a pandemic. I mean, that's truly, I've seen a lot of folks who have been struggling with that lately.
I think we're good. And then we covet what we don't want people to see. So
yeah.
If we're having a struggle with our weight, and that messes with our self-esteem, our self-value, our worth, and now the company's like, hey, you can work from home. And so now, maybe, going into work, certain things that might have given us structure or kind of, always, Hawthorne theory that somebody else is watching. Now we can do that. Maybe we're not getting up on, a certain time, we're not walking around as much. We're not doing all of these things. And so I have seen a huge problem with people not excelling at their capacity. I'm not sure like which way to say that. Like, they're saying, oh, I need to get this medicine, or I need to do this, I need to do this. And I'm like, well, what are you doing that you can do? We're really faced with the fact, when it comes to our weight and our health, people for so long, number one reason was, I don't have time. So, when stuff,
right. And now we're granted more time. It's been an interesting shift.
So what are we doing with that time? Yes.
Yes.
So now what do we, and I do think that bothers some people, like, oh shoot, when I didn't have time, I wasn't doing it. Now that I have this extra time, and people are like, well, I don't have extra time, I'm still working. I'm like, well, what time did you get up when you commuted? Oh, well, maybe I got up at 6:30.
That commute,
And how long?
that commute has
Exactly.
changed. Yes, has changed some. We've all talked about this here. I mean, we have to be, we have gained so much more time. We think we're more productive too without having to sit in traffic. But aside from that, we've been offered this ability to kind of, but it's sometimes hard too to be able to have to manage your own time outside of a routine that you don't know, right? So I think all of those things compile with,
Well, too, there's that extra
factors.
time. The extra time is not always, maybe sometimes isn't a positive versus a negative. I know that. So if you are still getting up at that same time, like somebody like me personally, I wake up the same exact time every day, regardless if it's a Saturday or Sunday. But if I'm not doing that 45-minute commute, you have that idle time. Is that a positive? Is it a negative? Are you doing something that's going to help your mental health? Or are you doing something that can unfortunately make it worse than what you want it to be? So I do think that concept of time has been really, really interesting, especially during COVID.
Yeah.
Well, and I think that's important. It's like, if we said, oh, we didn't have time to work out or get to the gym, and I'm saying, like, so what are we replacing in that 45-minute commute?
Right.
So people are like, oh, I'm just really tired, so I sleep a little bit later. So we're still coming up with these ways. And so I'm really, focusing on people excelling at their capacity. Oh, here in Texas, we got all kinds of stuff happening. And, so we have winter storms and, so now we can't go out because it's so cold, and now it's raining and we can't go out. And then guess what's going to happen? It's going to get too hot. And so then we can't go out then.
These
And so there's
extremes.
always this reason. And so that's why I think, when we were talking earlier, what are we doing to plan for it? So excel at your capacity. Can we get out? Can we start stretching before we get out of bed? Before we get out of bed, can we just 8 gulps of water in just to stay hydrated? Because I think when people are going to go back to the doctor and we're really comfortable going out, we're going to see a lot of really bad health conditions. People are deconditioned. There is a lot of individuals that have had significant weight gain and isolation. The brain thinks we're depressed. Right? We're doing the exact same thing that a person that truly is depressed, clinical depressed. I isolate. I don't talk to anybody. I don't reach out. I don't go out. I don't move around. And so the brain is confused. Like, are we depressed? And so I think that we're going to see a spike in, different kind of obesity-driven kind of illnesses, diabetes, heart issues, but mobility. I think that it's really important. I think, people at home, let's look at excelling at your capacity. What can I do in my house? Nobody knows, hey, how much longer is this going to last? Are we going to go to December? Is it going to be January, of next year? Let's just go, it's January. And I really encourage anybody out there that if you're really struggling with this, stop focusing on what you can't do. And I don't want to discount that, because I do think that was missed. When the mail carriers couldn't come or we lost power, our first thing was like, people can't get their psych meds, or we have people in the house that have O2 and they don't have, electric. And so do we realize that not getting to the gym, not seeing our kids, not hugging our friends, not fellowshipping, not be at church or, going out after hours, that is your personal prescription. And I think that's been discounted. We might not be able to get the medication, and that's a big problem. But it's also a problem when we can't do what personally makes us well. So we have to kind of come up with a new plan for 2021. What is that?
All right. Well, we're having some really good reflections in the chat that are coming through. So I'm so happy this topic is resonating. I think we had no doubt it was. But just folks have been sharing some of their own tactics. They've also shared that just thinking about, medical needs throughout this and how telehealth has been an impactful part of this. And I think, that's been a really, silver lining on some of this, is that you do still have some of that accessibility to a degree with that. So I think, and it does seem this topic is resonating, because even we have Linda who shares that she's starting to become more knowledgeable about mental health. And perhaps, I think, could you say that this whole situation, like you said, we're all been going through the same types of emotions in different ways at different times. But I think it's all about how that's why mental health has become just this topic that has risen, that is just so prominent in all of our lives these days, right?
Yeah, I think there should be a new awareness. One, if we are always complaining about what everybody else does, we've been with ourselves long enough to realize, hey, am I the common denominator? Are there pieces that I need to work on me? So we've been quiet, all by ourselves for a while, or we've been, stuck in the house with the people that we love all the time. And so there have been incredible new challenges. And so I think, yes, there have been things that came on the media. There's awesome apps. I was really impressed with, Prince Williams. He came out with Heads Together. And I was, there's some things that are really, oh, that's nice. But to listen to the topics about kindness and about, bullying and about how to not only be a friend, but allow other people to be a friend to you. I mean, those things are really important. So yes, I think there's apps that you can go to, but your own understanding of where you're at, I think, has changed. Like, we have to listen to ourselves when we're isolated for this long. What do our thoughts say? I'm so, maybe people are so busy. Oh, traffic. And, of course I'm tired because I have traffic and so at work and this and this. And now all of a sudden it's you and you still feel the same way. We're going to have to be humbled in a lot of ways. I think we are humbled in the sense that we appreciate other people when they're struggling, when they say they're depressed, and we're like, well, just, do this. And now that we've gone through it or have a different perspective, we might be a little bit more open, I hope, to allowing people to talk, especially when there's several people who needed somebody to talk to, but they weren't around for others, and they found that nobody was around for them. That was a very tough thing last year.
No, and I think that support system is so key, and I know our folks know that firsthand, which is why, thinking about something like our national meeting that we do, that was such an important part of folks' lives. But what I am hearing in so much of this, is this idea that we've talked about resiliency. Right. And it's a shameless plug. And I know because we worked on this topic, but that is going to be what you're going to open us up on our convention floor to talk about this resiliency during restless times. So I think you kind of gave us a little bit of a sneak peek into that.
A little bit, yeah.
Yeah.
I mean, it's important. And I think we're going to need it more so than ever because not everybody's going to bounce back. I hope, and I think through the whole thing, I always kept telling myself, like, I hope I come out of this stronger than I went in it. I hope I come out being better than I was when I came in it, because there's some terrible things that, have gone on in this year. And I know not only me as a therapist, but multiple therapists taking inventories for, compassion fatigue, huge. That's not just for therapists, but for moms and for dads and, for anybody that is taking care of being with somebody else. So being able to bounce back, and that's a big thing about mental health, our ability to deal with, I'm not sure what normal is anymore, but typical stressors, being able to deal with that and then getting back up. We have tendency when it comes to resiliency, people are digging us down in a hole and we grab the shovel and start digging with them. And so that's been one of the things I've said this year is like, put down the shovel. The world is already kicking us and, digging our hole, like, don't help them. So just, that resiliency of knowing what's in my toolbox. And if I need to restock it, let me get some really good information and make sure that I know where they're at when I need them.
I think the importance that you really talked about a lot today too, Merrill, was the mental health aspect of it, because I think what's kind of brought us to this topic, COVID-19, the media and the healthcare world focus so much on the physical aspects of the virus and the physical side effects of the virus, but what are the mental side effects of the COVID-19 pandemic? The isolation, not talking with family and friends. Like you said, all those rites of passage, you think back when you were younger, the prom, homecoming, weddings, all those things that people wait years and years and years for, and it never happened. And I think you just really brought to life and highlighted in such a good way the importance of taking care of our mental health as much as our physical health, which I think is something that's unfortunately sometimes gets sidelined, especially with the busyness and chaotic way of life sometimes.
Yeah, I think the one thing when we were talking about the person who mentioned telehealth, I think, we came probably like 10 years in a year, everything that couldn't be done, right?
Just
everything, you can't do, yes, you can't do therapy on there. You can't do certain things. Oh, wow, really? Look what we can, and how much more accessibility that we have. I did read a report that Beacon Health did, and I was a little bit surprised that they showed an increase in a lot of the mental health and mental illness issues, but they said that they didn't see an increase in people reaching out. So that was a bit concerning to me. I would expect that we would have a bigger outcry. So, I'm going to look at some other things and see if we have coordinating information on there so that we see that. I know that I am very busy. I know a lot of therapists couldn't, withstand the year. So being able to have access, at the end of this, you guys, there's a lot of different websites. We think that we can't because we don't have insurance, maybe. Because look how many people have lost their jobs, how many unemployment, so we think that, oh, because I don't have a job or, I don't have anywhere to go, that there's a lot of resources that provide immediate help. A lot of times you're calling a therapist trying to get immediate help, and there's like paperwork and there's things that have to be done. There are hotlines. So, several resources we could definitely talk about that are there for you immediately.
And Merrill, we actually have all those, so they're on the screen right now. We have some support resources up there for folks to check out. And then on the YouTube, OAC's YouTube channel as well, in the description, we also have all of the links for these different organizations and hotlines for people to check out as well. They're really great resources. And I think for those tuning in today, you got a nice sneak peek at vitamin M, and when the broadcast is over, you got a dose of vitamin M.
Just a dose.
And when the broadcast is over, the next thing you need to do is go to ywmconvention.com, register for convention, and make sure you sign up for Merrill's talks, especially if you love today's talk.
Yes, well, no, Merrill, thank you so much for joining us on our broadcast. We really could spend so much more time. Yes. But maybe we make folks have to kind of tune in for your great talk you're preparing in in just several weeks here. So, but thank you so much for joining us. Last words for our group that's joining us online, words of encouragement, support.
Excel at your capacity. It's not over unless you believe it's over.
Yeah. Hear, hear.
I love that.
Yeah.
Very nice.
Yes. So great to see you, Merrill. We'll see you here in the next several weeks. And for now, we will say goodbye and close up our broadcast for today.
Bye, everybody. Miss you much.
Yes, thank you, Merrill. Bye.
I don't know, I really did truly feel like a sense of family there for a moment, just because I think we are so used to, and that's all these mental health challenges that we've been where we haven't seen the folks we're used to seeing, and so it was so good to see her.
But she's just always phenomenal. I mean, that's the thing about Merrill, you can actually kind of just, you just kind of melt into what she's saying, right? And yes. even here, sitting here hosting the broadcast with you, you kind of like start thinking in your own life even. Like, I mean, she's got a gift. I mean, it really is.
We're very, very lucky to have her in our corner. So,
speaking of gifts,
good gift time.
Good gift giveaway time
giveaways.
Here. So it looks like our first winner is going to be Jay Daniels for the tumbler. And Christy actually has that right over there.
You are this lucky beverage container is going to come your way, Mr. Daniels. So thank you for joining our broadcast. And it looks like we have Carol Joseph, who is won the free full convention registration.
Very nice.
Congratulations, Carol. So we'll direct message you and get in contact with you in some capacity on our YouTube channel. I'm not sure how that's going to happen, but
yeah, they can actually email us. So if they want to email us the contact information, you can send that to info@obesityaction.org, info@obesityaction.org, and we'll make sure our team knows how to get you your giveaway items, and we'll get them out to you soon.
And claim those prizes, definitely. So we so appreciate each of you joining us today on this new platform. We're excited to continue this, and as part of that, it's a good reminder that as OAC does do this, we are a 501c3 charity, so your donations to support this effort and so many more are much appreciated.
Absolutely.
Much appreciated. So if you'd like to make a donation in support of this work and other work we do, you can see the link on your screen, obesityaction.org/donate, and we appreciate your generosity. So for now, we are going to say goodbye, but that's not going to, just in a few more weeks, we're going to be back here doing this again.
We are very excited. I think as we talked about today, so many amazing things coming up, coming down the OAC pipeline. So please make sure you're connected to us. And as Christy said, donate. All the stuff we talked about in today's broadcast, the brochure, the magazine, the brand new OAC Health Talks, these are all done at no charge.
Yep.
And so definitely if you're watching, please consider heading on over and making a donation to the OAC.
And mark your calendars. June 16th is our next broadcast date. I wanted to check that before. You're going to be on vacation.
I will be on vacation.
But Mackenzie Burrows from our team is going to be sitting in your seat next month.
But I'll be back on July 14th.
Yes,
which is a very special day for me.
Your son's
as well.
birthday. He is going to broadcast on his son's birthday in July. So we'll make sure we put those dates out there for you guys. But for now, we'll say goodbye. And we hope you explore all the great things that we do and stay connected to us all around.
Thank you.
Thank you. Take care.
Bye.